Do you have pain in the bottom of your foot when you first wake up and get out of bed in the morning, or pain during runs, or pain on the golf course? That typically is caused by the lovely plantar fasciitis, which can be a very challenging condition to treat. Here at West County Spine and Joint, we have formulated a great set of treatment tools to really help plantar fasciitis get kicked to the curb quickly. One of those techniques is called Graston technique. They are stainless steel metal tools that have a little beveled edge to them that are fantastic at bringing more blood flow to areas like the bottom of the foot, other areas that have fascia in them in the body, to bring more blood flow, get joints less restricted, and to get things feeling better. So let's dive in a little deeper into this patient's calf and foot and show you what a treatment with Graston looks like. First, we use a little lotion over skin so that tool glides easy. And the plantar fascia starts often where we have that little ball of pain right at the bottom of heel and then comes down. And when we use these stainless steel metal tools, different kinds of tissue resonates differently through the stainless steel. So as I am feeling this plantar fascia, I can feel right when we come off bone and in the thick of it, things go crunch, 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 crunch right under me. I call that Rice Krispie treats. And those are the fascial adhesions that we are working to loosen when we use the Graston technique. 9 times out of 10, when we have pain on the bottom of foot with plantar fascia, we also have restrictions and tensions in the calf as well. So we will use the Graston tools all the way up the calf, especially on the inside part of the calf. And same thing as the bottom of the foot on this person's calf. When I come up the inside, I feel that same bump, 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 crunch, 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 right over top of those fascial restrictions. So typically with the Graston technique, the area treating will get pretty red. It is not the purpose to bruise the patient or make anything look too colorful. But everyone is a little different. Some people do look a little more discolored than others after treatment. And also the body part we're working on, some areas are a little more prone to getting discolored. So we will work through this area with the tools, oftentimes adding movement with it. So go ahead and point and flex your foot up and down. And when the patient moves, adds motion to the treatment, different tensions and adhesions pop up a little more. Now I feel more in the middle of his muscle belly of the calf. A typical treatment will last anywhere from 2 to 10 minutes, depending on the area we are working and the severity of symptoms. And we will treat an area typically 2 times a week for several weeks, because we'd like 24 to 48 hours in between each treatment to let the body rest and recover. Now that you've watched a sample Graston technique treatment, you might be thinking a few questions. The most common questions we get are, first, does it hurt? And I always explain it as it's never going to feel like a lovey-dovey massage, but it shouldn't be too uncomfortable. And oftentimes we've all had those deep tissue massages where you kind of grit your teeth through the massage. This shouldn't be that. This should be something where you feel like we are deeply releasing adhesions and muscles, but you're not necessarily having to grit your teeth through it. Second most common question is, can I still exercise today? Can I still get my workout in? Absolutely. Depending on the area we work on and the intensity or depth of treatment, 95 times out of 100 will still recommend you moving your body on the day of treatment. Sometimes if we do a lot of work over multiple regions in the body, that's a lot for body to process, and that can leave us feeling a little flat. So we will always tell you that if we've worked a lot of areas, hey, if you still have a workout today, if you feel a little flat, that's okay. It's your body processing everything that we've done today. Other things that can help healing happen a little faster is making sure that we have adequate fluid intake and that we've consumed enough protein every day, but definitely on days of treatment, because if we're expecting body to heal and recover, we certainly need to give it the building blocks to be able to do so. Other question we get commonly is, am I going to bruise? Every patient is different. It is not the goal or intention of treatment to give you a bruise, but some people are a little more sensitive than others, and we're bringing more blood to the surface, and so a bruise can happen. Lastly, the way we think in this office is that There's no muscle that doesn't end at a bone or joint somewhere, and no bone or joint in our body, except for a couple in your ear, that don't have a piece of soft tissue attached to it. So while we just did a Graston technique treatment on this patient's foot and calf, he has a heel and a foot and a knee and a hip that also connect to these fascial lines. So almost 100% of the time, we will find what joints are restricted. Almost always in plantar issues, it's in the ankle and bones of foot, and adjust that as well so that we can get maximum effect from our treatment. And lastly, we will almost always give you some homework, some things to do at home, because we know everything we do in the office is very effective. But if we still go back to sitting at our desk all day, running in shoes that are a little old, or not having the most ideal biomechanics, then these things can return. And the likelihood of that returning, if we are treating it in office and you're doing things to help yourself at home, that is reduced drastically. So with that combo of in-office soft tissue treatment, in-office adjustments and mobilization of joint, and you doing exercises at home, we are very confident that we can help you get over your plantar fascia pain.